Hello there, listeners. It's Susie New from the Australian Society of Anaesthetists, and welcome to our podcast. It's called Australian Anaesthesia, and it's where we talk about all things relevant to anaesthesia in Australia. This episode is part of a new series which is focused on the anaesthesia Viva exams. If this exam was something that is a distant or not too distant memory for you, then I do recommend this podcast as a great refresher. Don't forget, if you're going to use it for this purpose, to claim listening as part of your continuing professional development. So get those CPD points. This series is brought to you by Doctors Viva and Kaylee Jordan, and I hope you'll recognise it because they're featured on the cover art. Now, I can't imagine two better anaesthetists to create these podcasts. Vida is the Australian Society of Anaesthetists, otherwise known as the ASA's, Education Officer and one-time chair of the college's final exam committee. Kaylee won the prize for the first part exam and a merit for the second part exam. So I hope you agree we have some very well-credentialed people here. Both Vida and Kaylee have been tireless in providing the ASA online practice Viva sessions and in their enthusiasm for supporting trainees through the exam process, which is why they're so passionate about also bringing this podcast to you. So how these are going to work is we'll share the Viva STEM with you here, but to access the rest of the Viva podcast, you will need to log into the ASA website and go to the ASA education page. Of course, I'll put a link to that page in the show notes. In the full episode, you'll get the Viva STEM, the rest of the Viva questions, as well as Vida and Kaylee's discussion and breakdown of the questions, as well as how they might approach answering them. All right, let's get into this week's Viva question.
You are working overnight in a regional hospital. Your next patient is a 56-year-old male with septic arthritis of his right shoulder, 2 weeks post-shoulder arthroscopy, requiring urgent arthroscopic washout. He has a temperature of 38.5 degrees, a heart rate of 120 beats per minute, and a blood pressure of 135/80. Other than complaining of right shoulder pain, he has no other symptoms. He tells you that he has a history of long QT syndrome. What other information would you like from him to assess this long QT syndrome further?
Well, there you go. How do you manage a patient who tells you that they have long QT syndrome? If you want to do this as a practice Viva or to get that refresher, then please log into the ASA website. Also on that page, you'll find videos of past practice Viva sessions. If you're wanting to attend an online practice Viva session, so the live event, then please visit our events page to register. Of course, you'll need to be a member of the Australian Society of Anaesthetists, and they are complimentary. Until then, good luck with the studies, good luck with the exams, and I hope you're staying safe and well out there. This episode of the Australian Anaesthesia podcast was produced by the Australian Society of Anaesthetists, otherwise known as the ASA. More episodes can be found on the ASA website, asa@asa.org.au. Don't forget to follow or subscribe to receive the latest episodes, and of course, you're welcome to share them as widely as you wish. Please send any feedback to the ASA by emailing asa@asa.org.au. Music was by Mark Suss, and we hope you enjoyed listening.